Medicare for all may sound good, but it's actually not good policy, nor is it good politics.
If you want to keep your insurance, you can keep your insurance.
We don't need Medicare for all proposals. The public option will make health care more affordable.
Socialism is not the answer. We shouldn't try to achieve universal coverage by removing private insurance from over 150 million Americans.
We will fight against the socialist tides. They want to take our health care.
I want to ask about this matter of choice. Is that a misleading word to use if your plan eventually takes away the choice for private insurance?
The bill like the one I have called Medicare X that creates a public option.
The plan I proposed is building on Obamacare and providing a public option.
Mayor Pete Buttigieg, he's been pushing back against Sanders' more extreme positions like mandatory Medicare for all with his own voluntary Medicare buy-in for those who want it.
Through my Medicare for All Who Want It plan. Medicare for all who want it.
It is a little disheartening to hear some of the candidates drinking the Kool-Aid from the private insurance industry that everyone is in love with their private insurance, mostly provided through their employer. If people understood the way the marketplace works with private insurance, they really wouldn't love their private insurance. This choice issue, it's a false choice. You really don't have true choice with private health insurance.
Welcome to Truth Seekers Health Justice. Today with Dr. Vincent Markovczyk. Dr. Markovczyk has practiced emergency medicine almost 40 years. The last 20 years he spent as Director of Emergency Services at Denver Health. Working in emergency medicine brought Dr. Markovczyk face-to-face with healthcare disparities. He asked why, in a hospital providing excellent medical care, should people be facing bankruptcy?
Where you don't have much control of your doctor and hospital is with every private insurance company. Each private insurance plan has their own network of providers, hospitals and doctors. Private insurance companies dictate which doctor and hospital you must go to, or you're going to be out of network and you're going to be liable for large medical bills beyond your deductible.
It is pretense that people have choice of private health insurance. Insurers may drop anyone on a dime.
Private insurance have a total discretion as to whether they want to stay in a certain marketplace or not. You could lose your doctor in the middle of the year. They could drop hospitals and doctors at any time they want. That leaves the patients totally out in the cold. They lose insurance access to both the providers and the hospitals.
Recently, United Healthcare dropped 8 Houston Methodist hospitals and dozens of outpatient facilities from its network, affecting as many as 100,000 United Healthcare members in Medicare Advantage and private plans. United Healthcare plans to drop 800 Methodist-employed doctors in April.
Original Medicare, not Medicare Advantage, but Original Medicare, gives you totally free choice of doctor and hospital anywhere in the United States. 95% of doctors and virtually every hospital that's not a small privately owned specialty hospital accepts Medicare patients. Many private insurance plans have deductibles of $5,000 to $10,000, which means the individuals responsible for the first $5,000 or $10,000 paid out for their health care that year. Most people don't realize how much this is because they don't get sick. And if they don't get sick, these premiums are being paid, and they say, well, I've got great health insurance and I like it. They don't like it when they get sick and they start getting the bills.
Insurers and employers annually shift risk and cost to employees.
Premiums have been rising 3 to 4 times the rate of inflation. These huge healthcare premiums paid primarily by the employer are now being passed down more and more to the employee. One of the reasons for wage stagnation over the last 25 years has been the fact that employers have been facing higher and higher health insurance premiums every year. So they're paying more and more in premiums, and there's less money for other benefits and for wage increases. So one of the reasons wages have not gone up is because health insurance costs have gone up so dramatically.
Multiple small risk pool insurance plans exponentially increase administrative cost and complexity for doctors and hospitals. U.S. doctors pay 4 times as much as Canadian doctors.
The average physician in private practice spends about $80,000 a year just for billing and collecting and negotiating with private insurance companies. This includes ancillary staff that they have to hire, as well as the time it takes them to appeal, to negotiate, and to try and get paid from the private insurance companies or to get pre-approval for procedures or tests they prescribe for their patients. That's a huge amount of money. That's part of the waste in this healthcare system. Hospitals have to have a huge cadre of people in their billing offices to do the same thing that doctors have to do to negotiate with and to bill private insurance companies.
Faux Medicare proposals like Medicare for those who want it, Medicare X, and other iterations of a public option are built around administratively complex, actuarially unsound small risk pool insurance plans that fall far short of administrative savings achievable with original large risk pool Medicare.
Medicare for those who want it. Public option that's being talked about by many of our politicians will not work, because the risk pool will be skewed even more toward the public option in Medicare for the sick patients, where the healthy patients will continue in the private insurance marketplace. A true public option is going to be funded and backed by taxpayers. The private insurance companies would take people who get sick and encourage them to move into the public option. In fact, that happens now with Medicare Advantage. It's called lemon dropping. You take the sick people and get them out of your plan.
Faux Medicare is a gift to private insurers, permitting them to cherry-pick the healthiest, most profitable clients, while rejecting the costlier, sickest, who are forced into a public option. It is not choice of insurance that people need. People require full choice of doctors and hospitals, available only with a traditional Medicare model.
A large part of the waste in healthcare is the huge administrative overhead because of the myriad of private companies in the middle. Private health insurers, pharmacy benefit managers, all of the costs of doing billing and collecting. That would all be streamlined and markedly decreased by a publicly financed single-payer system. Those $500 or $600 billion a year in savings could then be put back into providing medical care to insure the 30 million people who have no insurance right now. With Medicare for All that's being proposed right now, both in the House and the Senate, the copays and deductibles will essentially go away. Premiums that now average about $24,000 a year for a family will go away and be replaced by some type of progressive tax system to fund Medicare for All, which almost certainly for 90% of individuals will result in less than they're paying for health care now. Bankruptcy for medical bills happens in no other country in the world except ours. In 2018, $88 billion was borrowed by individuals to try and pay their medical bills. That goes away because you would be covered. The 500,000 people that declared bankruptcy last year, in whole or in part because they couldn't pay a medical bill, that disappears. And under a publicly financed single-payer Medicare for All, there would be no bankruptcies. 2003 Medicare Part D law prohibits Medicare and Medicaid from negotiating drug prices. And that's because the pharmaceutical companies wrote the law. Every private insurance company can negotiate prices. Canada negotiates prices, which is the reason why their same prescription drugs are half the cost of what they are here. The other thing they did, of course, is they put private insurers in the middle of your getting your prescriptions. You can't take your prescription from your doctor, say, I'm on Medicare, and take it to a pharmacy and get it filled. You have to contract with a private insurance company to provide your outpatient prescription drugs. You got to pay them X number of dollars per month for the privilege of going through them to get your prescriptions filled.
Numerous studies since 1991 have demonstrated hundreds of billions of dollars in annual savings with Medicare for All.
In a new study, Yale scholars have found that Medicare for All will save Americans more than $450 billion and prevent 68,000 deaths every year. The study in The Lancet, one of the oldest and most prestigious peer-reviewed medical journals, found that Medicare for All, supported by Bernie Sanders and Elizabeth Warren, will save money and is more cost-effective than Medicare for All Who Want It, a model supported by Pete Buttigieg.
This is what they said in that article, and I quote, "Taking into account both the cost of coverage expansion," in other words, on the Medicare for All, more people are starting to get the health care they need, and the savings that would be achieved through the Medicare for All Act, we calculate that a single-payer universal health care system is likely to lead to a 13% savings in national health care expenditure, equivalent to more than $450 billion annually. In other words, if we end the profiteering of the insurance companies and the drug companies, and they made $100 billion in profits last year, if we end the absurdity of having thousands of different health care plans and the hundreds of billions it takes to administer these thousands of plans, we can save $500 billion a year by ending the administrative nightmare that currently exists in healthcare.
This has been True Seekers Health Justice, today with Dr. Vincent Markovchik.
Truth Seekers, produced at Denver Open Media. Music mix by Tim Johnson. Underwriting by Healthcare for All Colorado Foundation.
This is Michelle Swenson, producer.
Thank you for joining Truth Seekers, advocating for the most sustainable universal health insurance model, a single large risk pool Medicare for All health insurance.
Everyone does better when everybody is covered.